once we understand what depression is, what this illness called depression is, then the next logical question that comes to mind is, are there different kinds of depression? As a psychiatrist, for me, I need to understand what kind of depression I'm dealing with, because that will influence the choice of treatment that I would make for a particular person or a particular client who has come to me. Broadly speaking, I would divide depression into two broad categories. One is what we call endogenous depression, and the other is what we call exogenous depression. Now, as the name implies, I mean, it's self-explanatory. Endogenous depression refers to a kind of illness which arises purely from inside the individual. We are talking about different chemicals, different neurotransmitters, which the brain is using to perform all its functions. Normally, the brain would keep the level of all these neurotransmitters or these chemicals in a very well-defined normal range. But in some people, either without a cause or for some possible associated cause, the level of one or two of these chemicals, it starts to fall down and it comes below the lower limit of normal. And when there is a relative deficit of the available amount of the chemical inside the brain, loosely a lot of people would call it a chemical imbalance, that is what we would call as an endogenous form of depression. It is important to understand this because if it is endogenous in nature, then the primary intervention or the primary treatment that I would advocate for that person would be medication, which would serve to increase the level of this chemical which has fallen down. In the other type of depression, which we call exogenous depression, I would say that this is a depression which is reactive to events that are happening in the external environment. Now, when events are happening in the external environment which are creating a lot of stress inside the person's mind, it could be a child who has exams coming up, he or she is very tense about it. It could be someone who's working, who's in danger of losing a job. There's been a death of someone close to you, that means there's been a bereavement, or you've suffered losses in the stock market, or there's been a robbery, and I mean any of a vast multitude of stressors which would take place in anyone's life. When any of these stressors take place, in some people they're not able to adapt in a healthy or in an appropriate fashion to that stressor. And the reaction of the body and the reaction of the mind is to go into a state of depression. Now, in such a case, this is what we call a reactive depression. It's a reaction to circumstances in life. And if it's a reaction to these circumstances, the symptoms of this reactive or exogenous depression would be different from the symptoms to a large extent from what we would see in endogenous depression. And here, the treatment of choice, in my opinion, would primarily be what a layperson would call counseling and what I call psychotherapy. So just to summarize this, the two different kinds of depressions that we would look at in the clinic would be either an endogenous depression, which is a chemical imbalance arising from within the body, and an exogenous or reactive depression, which is a reaction to circumstances or events in that person's life.